So we see approximately 35,000 visits a year, and that certainly fluctuates year to year, depending on snow conditions, depending on volumes in the summertime, etc. But yes, we're a very busy community emergency center.
We are approaching around 75% of the same volumes that Whistler sees per year in terms of skier visits per year. I came here to train when I was training for emergency medicine, and I never left. It's actually become a destination for training physicians. I chose to come here because of the opportunities it provided specifically for orthopedic injuries. And I'm proud to say that it's become a destination for other physicians to learn how to deal with those types of injuries.
So I think first and foremost, my job as the chief is to ensure that we have the personnel to deal with the patients that are coming in, and I'm so very proud of the team we've put together. We have a highly skilled group of emergency physicians and nurses. The residents who are training doctors around the province clamor to get the few spots that we have available, so recognizing that the experience they get at Collingwood Hospital is far and beyond what they would get anywhere else in terms of the volume and the complexity of ski-related trauma. When you arrive at the hospital till when you're seen by a physician, we are the third fastest in all of the province, and we've worked really hard for that. We're involved in the preventative stages with Alpine Ontario and with a number of the head coaches in the clubs. Education, safety education, simple things, ski down the middle of the hill. Recognizing that prevention is part of our responsibility. As parents and as athletes ourselves, we would obviously like to prevent injury.
I'm a medical radiologist with a specialty in musculoskeletal imaging, and that fits really well with the community here and the type of work that we do. I'm a skier myself, and I know that just about anything can happen up on the hill, and I feel confident knowing that there's a hospital right here that can help take care of me if anything happens.
With the way the sport has evolved over the last 5 to 10 years, the athletes are performing at a higher level. The risk of injury is getting greater.
You always, as a parent, I think you think your kid's not going to get hurt, but they do. And when it happens, you want to make sure that the facility's there, and we feel it's here.
Our medical imaging department is very well equipped. We have virtually all imaging modalities here, from state-of-the-art CT, ultrasound, plain radiography. In particular, I'm standing in front of our CT machine, which was installed within the last few years, and is one of the more advanced machines in Canada, so much so that it's used as a training facility for other sites.
I did an extra year of training at the Fowler Kennedy Sport Medicine Clinic in London, Ontario. Initially started by Peter Fowler. I was fortunate enough to spend a year training with them to gain some further expertise in dealing with complex ligament injuries around the knee and around the shoulder, and also dealing with very specific type injuries that elite athletes and elite skiers would have to endure sometimes. Part of the art of medicine is dealing with patients' expectations. And when you're dealing with high-level athletes, their expectations are oftentimes different than someone who's not an elite athlete. And I think it is our job as doctors to recognize and appreciate those concerns that the athletes have and their families have, and to take that into consideration when we're managing them.
I had my first surgery when I was 15 years old, and at that time, you're pretty young. All your big dreams are, I want to get back on the mountain and ride and compete, and you have so many high expectations for yourself.
Yeah, and Palmer went to the Olympics at 17, so at 15 she had her first knee surgery. So you had 3 knee surgeries and fractured back in those 2 years. And her goal wasn't to make 2010, it was to make the next Olympics.
Yeah, 2014.
And with all those injuries and the treatment she got provided, she was still able to make 2010. As parents, we're out on the hill, and there is risks to accidents. And I'm a classic example.
Yeah, look at you.
I fell snowboarding and put my fist into my abdomen, and it was a fluke, and I tore my ureter, the tube off the kidney, and so I was taken to Collingwood, and it was diagnosed, CAT scanned, and then sent off, and I had surgery that day. And like myself, I was naive to understand how much the hospital needs financially, and I didn't realize that the equipment in a hospital wasn't really provided by the government, and it's all that stuff that, as a parent, and if we want that facility here, that we need to go out and provide. We belong to great clubs in Blue Mountain, and there's great patrollers, and when we're handed off to the hospital, most of that stuff has to be provided for from the community. So if you're going to support anything, supporting the Collingwood Hospital, I'd say, is the way to go.
Even excellent teams need help. Please join us as we fundraise for our emergency department renovation in Collingwood.